Hello everyone, I am Dr. N. Murugan. I am working as a hepatologist, as a liver specialist in the Apollo Hospital Group in Chennai. This is a short message about fatty liver disease. It's a very common problem across the world and increasingly a common problem in India. This is a fatty liver disease which comes when patients don't take alcohol. So this may come as a shock to many of you, because most of you think that liver disease and fatty liver disease is related to drinking alcohol. But there are a large proportion of people living in our country who develop fatty liver disease. Many women come with this problem and they don't drink alcohol at all. So why does this happen? Unfortunately, due to changing lifestyle or diet pattern with more consumption of simple carbohydrates, the level of fat insulin resistance increases and this gets deposited as fatty liver. This is to explain it in a simple way. So people who are overweight or obese, which is also increasing in our country, people with diabetes, and people sometimes with blood lipid problems, triglyceride problems, are prone to develop fatty liver. It's a very common problem, and you'll be shocked to know that almost 25-30% of the population in India are likely to have fatty liver, and definitely it is much more in urban and semi-urban areas than in the rural areas. Again, due to increased food habits and reduced activity. This combination leads to this problem. So what is the importance of this fatty liver? For many years, including doctors, we used to think that it's just fat, so what is not going to harm you? But now we know that fat is harmful, whether it is simple obesity in the body or fat in the liver, it is definitely harmful to you. Luckily, not everybody with fatty liver will end up with problems, but many of you will. So you need to know what your chances of getting disease is. So I always emphasize to my patient, there is no general rule for fatty liver disease. You have to decide what your problem is, what your risk factors are, and what is your likelihood of getting disease, and then what you can do about it to avoid it. Or if you already have disease, go for treatment. So this is the way to approach it. It's an individualist approach. So people who are overweight, obese, have diabetes, high blood pressure, cardiac disease, again all common problems, they are all interlinked, and there is a syndrome called metabolic syndrome which links all these risk factors together, and people with this risk factor are more likely to have liver disease. What you can do about it? Many times with just simple lifestyle changes like taking a healthier diet with less carbohydrates and less fat and more protein, and eating less calorie will help. Of course, if you're overweight, you have to lose weight and bring it down to the ideal weight, and regular amount of exercise itself will help to mobilize fat and reduce the impact on the liver. So this is something you can do. What is also important is to assess your risk factors, assess the status of your liver disease. There are tests to do this, and see whether already you have liver disease or you have high risk for liver disease. There are some patients who already have silently liver disease, who silently progress to damage of liver called cirrhosis of liver, and this immediately puts them at risk for liver cancer, liver failure, and many times we are doing liver transplant for these patients. In fact, in the US, fatty liver disease is the most common reason for liver transplant, and I'm pretty sure unless we take adequate steps, we will be in that situation in India in the next 20 years. So it's an important disease to focus on because it is increasing, like diabetes in our country. I think it's the right time we step back and think about this because it affects our whole body and see what we can do about it. Thank you.